All right, let's get to your COVID-19 questions. Joining me tonight to share her knowledge, her advice, infectious diseases expert, Dr. Lenora Saxinger. Hello to you, doctor. Let's get started with question number one. And this is about the kind of prevailing wisdom of staying home when you're sick. Should people stay home from work even if they're just suffering from seasonal allergies? Or I suppose if you just think it's seasonal allergies.
That's a tough one, but I think there's a couple things that can help. One is seasonal allergies are often accompanied by a lot of itching, so itchy eyes, runny eyes. And if you have your classic symptoms that include itchy eyes, for example, especially if they respond to antihistamine medication, I think you're pretty good to go. If there's doubt, I think an excess of caution right now is reasonable. And if you ever do go out with symptoms you think are allergy and they seem to transition, it's not a bad idea to pay attention to who you've been around and where you've been to help with contact tracing. So, but I think if you think it's allergies and it responds to your allergy medication, you should be okay.
Okay. Next question. With cottage season starting to open up, is it safe to go swimming? Can the virus survive in open water?
Yeah, that's come up before, and I think there's really no evidence that we would expect virus to be transmissible in water, just sheerly by the large volume of water that you're looking at, and because it's mostly a respiratory infection. So I think people should feel comfortable going in the water at a lake, especially as long as they can maintain their distancing on the way in and out.
Would you say that applies to just a regular swimming pool as well?
Swimming pools worry me a little more just because of the changing room situation. If that can be maneuvered so that you don't have to stand too close to people, I think swimming pools are also fine.
Okay, interesting. Last question is a hard one. Do you think the vaccine will be mandatory?
Ooh, that is an interesting one. I guess the idea of a mandatory vaccine would have to be on the table because this is a very considerable public health threat that's changed the lives of everyone in the world over the past few months. And so I think if we were seeing that the vaccine uptake of a safe and effective vaccine wasn't adequate to get to the level of herd immunity, that would have to be discussed. I think that that would be an important thing to do because we would all like to get back to normal.
Right, because what would the consequence be if it's like the flu vaccine where you don't have everyone who gets it?
If you don't get adequate, I mean, there's a lot of unknowns around a vaccine, but I think if we don't get a level of vaccination within the community to get to a level where the virus can no longer transmit easily on a kind of endemic, constant basis, then there's not that much point in having the vaccine because you will still have people at risk and people who don't respond to the vaccine that you want to protect as well. So I think that it would be really important to try to define how many people we need to have get the vaccine, and if we're not getting there, we'd have to look at the measures that are important for public health.
Dr. Saxinger, thanks for your time.
Thank you.